I don't think we had a good gauge of how many patients had DVT and PE before this, because we only saw the absolute most severe cases.
Treating pulmonary embolism and treating DVT has been a very uncultivated part of medicine. We did have very few options of treating those diseases.
Like a lot of times these patients are sitting in the hallway in the ER or on the floor. They just get some blood thinners.
The STEMI process or someone having a stroke has become very streamlined now. So I think the question is, why hasn't VTEs become streamlined?
If you have a patient that comes into a facility or a hospital system that doesn't have a centralized source for taking care of DVT and pulmonary emboli patients, a lot of times you'll have the care of one particular specialty, right? So whether it's pulmonology, hematology, a cardiologist, a vascular surgeon, but not necessarily everybody getting involved at once.
We are now able to develop a program where patients can come from the emergency room to their procedure room and have an outstanding results in just no time.
What's different now is the emergency room physician involves either us or another member of the PERT team relatively quickly if they suspect PE or a significant leg DVT, to evaluate whether an intervention other than anticoagulation might be appropriate for that patient.
Certainly having a PERT process, we're able to get more of the patients into the main center, and we're able to treat them more efficiently and get them feeling better quicker, which was not there before.
At other places, one of the big concerns you have is who's going to follow up with this patient, who's going to make sure they're on their anticoagulation, who's going to make sure that several months have passed, there's no other risk factor, this patient can kind of come off. And here the team manages all that, and it's very helpful to do that.
Without that system in place, these are the areas that people fall through the cracks. And so that's the biggest change that we've seen since we've really started this up over the last couple of years.
It is a no-brainer that a VTE program is going to become the standard of care for patients with VTE.
You really have one good chance to get it right, and that's the first time.
This is the next wave. This is the streamlining of the VTE.
The impact is global, and the impact is not only on that particular hospital stay, but we have reduced the comorbidities that happen as a consequence to the VTE event. It is a win-win situation to have a VTE program in your facility.
We've saved a lot of lives here because we have this program.
I don't know why someone wouldn't start one of these programs. That's how you change how these patients are cared for, and ultimately that's how you continue to progress medicine.